I have edema on my thigh, pink stuff in my eye, and I need you now. I've got a stomach pain that's low, fungus on my toe, and I need you now. He's an osteopathic legend called Dr. Morse right now.
Dr. Kevin Moss, good enough to join us. He's in the middle of a lot of life changes. He's not even close to retired. He's doing probably more stuff now than he's ever done. Oh, and by the way, he's moving. And he has found out the ultimate truth that over the course of a few years, boy, do we accumulate a lot of crap.
You know, Steve, it's amazing that you think you can move 10 pounds of potatoes into a 5-pound apartment, and it doesn't work.
So Doc has this big, beautiful house he's leaving, and he's downsizing.
Yes.
And none of your furniture fits.
Well, you know, you'd think that someone who is smart and is educated and has a couple degrees would maybe measure before they decided on where they
Oh,
were.
no. Oh, no. Is it like a hoarder situation, though, where they bring everything out on the front lawn and you have like the keep pile, the donate pile, and the trash pile?
I don't think that would work in your neighborhood.
No. But AD, the nice thing is that my little brother David, I shouldn't say my little brother, he's bigger than I am, but my younger brother David is actually going to move into this home. So everything I can't move is just a bonanza for him.
Yeah.
Yeah.
It's like a Price is Right showcase showdown.
Yeah.
Exactly.
Well, good luck with that and your stress level. In the meantime, a texter says, this is Nick, I got a question for the doc about second opinions. On February 28th, I had a full knee replacement. Welcome to the club. On April 1st, they went back in, did a manipulation. Ooh, that's the word you don't want to hear.
Mm-hmm.
They did a manipulation, and next week on the 24th, they're going back in to change a piece of plastic on the replacement knee. Should I be concerned about all this and be looking for a second opinion? I do not have range of motion back yet. I mean, the words that scare me, having gone through a knee replacement, Doc, are manipulation, piece of plastic. There's a lot going on here.
Yeah, absolutely. And, you know, we think about this as knee replacement saying, hey, you know, let's just take out this portion and put this back in. People have to understand that these orthopedic surgeons are not only great surgeons, because think about the nerves and the muscles and the blood vessels that go through there, but they're also engineers, because they have to look at, say, how are you going to stand now? What's the weight going to be based on? So I wouldn't be overly concerned. Sometimes they do have to go back in and make some adjustments, because think about it. For the past, 5, 6, 7 years, you've been walking a specific way because of your pain.
Right.
Now when the pain is gone, you go back to walking a different way. Well, that is going to make some changes. So certainly making some adjustments, it's unusual, it's rare, but certainly I wouldn't be overly concerned at all at this point. And just, the range of motion coming back again. I forgot when he said he had it.
Said February 28th, so he's about 6-7 weeks in.
Yeah.
So that sort of makes sense. But you have said before, and I assume the same applies here. If in your head you're hearing, I need to get a second opinion, you should probably do that, right?
Right. And you know what? And had we had this conversation in January, I'd say you get a second opinion before you have surgery. Getting a second opinion after you have surgery is a little more difficult now, because now the second surgeon doesn't know exactly what was done, doesn't know exactly what was found, and is going to be hesitant to jump into what potentially could be a problem. That being said, individuals who are thinking about having knee surgery done, absolutely get a couple of opinions. Go and see a couple people. Right now, orthopedic surgery used to be very generalized. Now it is extremely more specific. There are people that at Northwestern that just do knees and hips. Even though they're orthopedic surgeons, they could do backs, elbows, wrists, everything else. All they do is replacements for those joints. And those are the ones that you want, because they've seen everything. They know everything. They know what's the most up-to-date as far as implants, the problems that are seen. So really, certainly, if you're going to have major surgery like that, getting a second opinion prior to surgery and saying, how many of these have you done? Why are you using this piece of equipment, as my knee replacement, and let them walk you through it to a point where you feel comfortable that you're having the best person do this, not somebody you just happen to pick out of a phone book.
By the way, last night after Andre and I were involved in this trial of Pericles, the annual Hellenic Museum's mock trial of the Greek gods and the Greek legends, I walked back from Millennium Park, and, my new right knee, the 3 years old, still has that new knee smell. But as I'm walking back, the left knee's terrible, and the left knee needs to be done. And my limp, Doc, was significant enough that at one point somebody came up to me and handed me a piccolo. There was also a flag bearer and another guy, and we looked like a Civil War threesome just going up the street.
Well, it is interesting. A lot of people, just because one knee goes bad doesn't mean the other one's going to be good. The chances are that you will need to have both knees replaced in many, 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 many people. So it's a matter of, all right, now I know what I went through with the first one. What do I need to do for prehabilitation for the second one? And now you have all the questions you're going to ask the doctor as far as what needs to be done.
Do you wear a brace? I mean, should you be or one who has the same issues be wearing like a brace? And how do you even know what kind of a brace to get?
Call me. I've got 200 of them.
Okay.
I've ordered every brace possible in the last 20 years. I wear a compression sleeve when I play golf. It seems to help.
Yeah, it's okay. If you think about it, playing golf and the twisting in that, you can have the strongest rubber band around your knee, and unless it's totally stopping off, it's not going to do exactly what you want. If you look at football players that have bad knees and look at the equipment that they have on, those are really structurally made to support the knee. The compression, Steve, you said it. You have 200 of them because there isn't an ideal one now.
Right.
So, and fortunately with golf, at least the stress and the amount of stress is very well controlled versus a running sport like even running or football or pickleball or any of those where you don't know exactly where that joint's going to go in what direction.
When we come back, we'll talk to Doc about allergies, the pollen count, costplusdrugs.com. Did the eclipse affect your health? Why are you tired all the time? Are you doing a morning show? Oh, wait, now I'm talking to myself. Can your iPhone treat your depression? And what sort of health monitoring equipment is out there? And what should you be using? Yeah, we're going to get that all in one segment.
A lot going on.
Dr. Kevin Most, we got to go almost express lane service here, Doc, but I did want to bring this up. A woman named Crystal Methvin was arrested for crystal meth possession in the UK. You can't make it up, Doc.
That's yeah. Gosh, I start to look at your name and see where you're going to end up.
Right. That's why Anthony Weiner should never have sent out pictures of that because it's obvious.
It's like an actor being typecast.
It's amazing. All right, Doc, this Cost Plus Drugs, the listeners asking about it, costplusdrugs.com. This is Mark Cuban's thing. What's the early take on this? Is it working out?
Yeah, it is. And it's going to be fair for people, especially people who have poor insurance. If you look at your insurance policies, it really depends on how well you have as far as drug coverage. So people that don't have great drug coverage, this is going to be a good one. This is essentially, and I hate to say the Costco of this, but it's going to be, hey, here's what my cost is. Mark Cuban is going to say that, and I'm going to add a small amount. You eliminate a middleman, you eliminate a distribution, so it really comes down to being pretty darn good as far as an opportunity for people, especially if you're looking for generic drugs at the lowest cost possible.
Oh, that's what I need when it comes to Wegovy, Ozempic. No. So I have been sneezing nonstop. I have seasonal allergies, but boy, it has been so bad the past 2 weeks. Are the pollen counts just abnormally high for this time of year because it's been so warm, Doc?
Well, you know what? In AD, what's really going to happen is probably after this rain comes through and the weather warms up again. I mean, you could see the trees and the difference that it's made here in the last, I would assume 2 weeks. I mean, I left and there were no leaves on the tree. I came back and now everything's popping. Yeah. So certainly you're going to see, if you're allergic to any trees right now, it is really hitting. Now, individuals who are allergic to grass, you're going to start to notice that the grass is greening and it's starting to pop a little bit. Grass comes on a little bit later, probably more towards the beginning of May. So really, it's those tree allergies, and they are going to get worse over the next couple of weeks. And, this is the time. Take your Zyrtec, take your Allegra, Even if you don't have symptoms now, but you're allergic to some of the trees, go ahead and take them because you can preemptively stop some of those symptoms.
And on a really bad day, is it a horrible thing to take a second dose at night before you go to bed?
No, you can. You know, some individuals, you got to remember these drugs are not identical. It's not like Zyrtec and Allegra are the same. Some people take both of them. Not a lot of people, not highly. You know, some people say, hey, you know what? If you really are bad and your allergies are bad, go ahead and take a Benadryl at night. Great antihistamine, and it has two things. It might make you a little drowsy and allow you to fall asleep and at least keep your allergies in place. Individuals who have more allergies worse at night are probably more dust allergies from the house, and then I would look at what can you do in your home to make the air more purified to get rid of some of those allergies. If your allergies hit you when you get outside versus when you're in your home, two totally different allergies.
Do you have a recommendation on an air purifier or how we find one that's legit and good and one we ought to use?
You know, I don't, but I would say, you know, any of the health-related issues, I go to Consumer Reports, and you might see that's kind of weird. But Consumer Reports, not only do they look at the equipment and the quality of the equipment, but they also take into consideration physicians' viewpoints and physician and outline points. So I would look there if you're going to consider one for the home. People can have, you know, it attached to your heater, an air conditioner, and certainly that's going to help. But those really fine particles that are already in your bedroom, in, you know, the dust mites that we have, certainly having one in the room is very helpful.
The air just, to me, has been so dry in the last couple of weeks.
Yeah, it has.
Yeah.
Is it bad if I wake up, Doc, and I'm making this noise? Is that bad?
Well, you know, it's interesting you bring that up, Steve, is that people that wake up and they're like, oh, my mouth is so dry, you know, those are individuals that, okay, you're breathing through your mouth all night, you know, and those are ones, too, that we want to say, hey, have you been looked at for sleep apnea? How are you stopping your breathing, you know, because your body's trying to take the easiest path to get air in, and if it's through your mouth and not through your nose, you know, is there an issue there? So certainly something that individuals should be considering. But, again, we're going to be we're going to have dehumidifiers on here very soon instead of humidifiers, you know, right at that switch point.
Tom, executive producer Tom Hush, he mentioned that he wakes up with a dry mouth because his wife has a pillow over his head.
That's a whole different problem.
Probably is. Andrea.
All right, so we have more and more opportunities. We're talking about monitoring our health at home. Are we going too far, though? I mean, we can monitor everything, you know, on our watches, you know, if there's something we set up on our nightstand.
Well, I have my watch, too, which occasionally while I'm sitting here will go, a hard fall has been detected. I haven't gotten out of the chair.
Yours says, need time to stand.
So the monitoring is not perfect, but there's a lot of access to a lot of resources, right?
Absolutely. And, you know, think about monitoring, the history of monitoring. You know, what do we used to be able to monitor? We used to be able to take your temperature and your weight. But now look at it. We can monitor our blood pressure at home. We can track our exercise. We know what our heart rate is. We know what our heart rhythm is. Mm-hmm. During COVID, we bought pulse oximeters to see how much oxygen we were getting. So it's just exploded. And to Andrea's point, where's the crossing point? Where's the tipping point of are we doing too much? And it may be happening right now because the FDA probably this week or next week is going to approve over-the-counter purchase of continuous glucose monitoring. So you probably have seen people with little white things on their triceps, on the back of their arm. Those are those are diabetics. And what that does, it allows them to monitor their blood sugar throughout the day. No more do they have to stick their finger 3 times a day. They can get on their phone and see what their blood sugar is. Very important for diabetics. Isn't important for non-diabetics. And that's the argument right now is are we going to give these individuals too much information so that they're going to be saying, oh, wait a second, last time I ate that peach, my blood sugar went up, therefore I'm not going to eat a peach. Well, you have to understand that if you're non-diabetic, your body knows how to handle an increase in glucose. Mm-hmm. Secretes more insulin, it's taken out of your body, stored as glycogen in your liver so that you have energy sources when you're not eating. So it's one of those where we're right on that fine line of, boy, is this information that individuals don't need to know? And then there's the argument, hey, if I'm pre-diabetic, I want to know what my blood sugars are, and it's going to tell me to do different things, to exercise differently, to eat properly. So it's a fine line. There's a lot of arguments about it, but the FDA is going to approve that very soon. So you'll be able to buy one and stick it on your arm, and you'll know what your blood sugar is any time of the day.
Rejoin the app, REJOYN. There's lots of apps that purportedly say they can help with depression, meditation apps, things of that nature. This one's different, and it's a prescription app, and I think it's only for iPhone now, but if it's not on Android, it will be soon. Why is this different, and should we look at it?
Yeah, it's interesting that they did go this route. In order for them to go this route to be approved by the FDA, they had to do a study to show that it actually worked. Now, it being only by prescription really limits the number of people that can use it. Right? Right now, there's hundreds of apps right now that are out there for depression. This company said, no, you know what? We're going to take this very seriously. We're going to do the study. We're going to show it to psychiatrists, and we're really going to show that it works. So they took that extra step and really limited the population that they're going to give, but they're going to show that it works. Now, what most people understand, especially people listening here in Chicago, is, oh man, there's Central DuPage Hospital, my hospital. We have 30 psychiatrists on the medical staff, maybe even more, and they're all excellent psychiatrists. You get out to some of these rural counties, there's not one psychiatrist. There are psychiatrists within 5 counties. So really having the primary care doctor doing some of the psychiatric work, which is done now, but also now having an opportunity to do this treatment without having to see the patient every single day or having to see them. So they're on medication, doing this treatment, and it's really going to make an impact on people with basic science, objective data behind it versus I'm going to throw an app up and say I'm going to play this music and it's going to really, make me feel better.
Yeah. No. So before we let you go, Doc, did the eclipse have an impact on our health?
So many people, it's really interesting. We're so concerned about the eclipse and wait, what about the additional radiation? And the only thing it impacted is if you weren't smart enough to, if you looked at it, you certainly could definitely do some major damage to your eyes, just like if you look at the sun. But it's not going to throw off your circadian rhythm for your sleeping pattern because of the 4 minutes or 5 minutes, and even the people with the total eclipse. So it has, the eclipse sickness has nothing to do with that, but it's just individuals who have some anxiety around what was going to happen that day. So no impact. And we wanted to talk about this before, and I should have talked about it before the eclipse, but at least anybody in their back of their mind that says, oh, I'm still tired from that. No, it's not. It's in your mind.
Okay.
Yeah, there you go.
All right. Well, good luck with the move. If you need me to lift anything, call somebody else.